information provided in this podcast should not be considered medical advice. We encourage all listeners to consult their healthcare professionals for medical concerns. Thank you. Hello, my name is Enrico Bolanino. Welcome to AS InfoShare. So before we begin, I just want to say, I'm not a doctor or a medical professional. I just do this because I want to learn as much as I can about my disease. So I do the research and I put these together. Like I said in my very first episode, they say the best way to learn is to teach. And that's kind of what I'm trying to do. I don't consider myself a teacher, but I'm just trying to take the information that I have and present it in a form that I understand and I know how to work with. The other reason why I do this is to learn about social media and digital media. I was a broadcast professional, and I'm trying to learn the new media and the digital media and trying to put this all together. So if you can, please share this. Please subscribe to our channel if you haven't already done so. Please like the episodes, and please leave a comment. Let us know what you like, what you don't like. Give us some feedback. We'd love to hear from you. Subscribe, and more important than anything, please share and help us spread the word. And now, let's get into the episode. In this episode, we're talking about two targeted therapies for ankylosing spondylitis, biologics and JAK inhibitors, and we'll break down how these treatments actually work inside your body. Let's jump in. Before we can understand how these treatments work, we need to look at what's actually happening in your body when you have ankylosing spondylitis, or AS. AS causes your immune system to become overactive and misdirected. It starts attacking healthy areas of your body, especially the joints in your spine, pelvis, and the places where tendons and ligaments attach to bone. This leads to chronic inflammation, which causes stiffness, pain, and reduced mobility, especially in the lower back and hips. And over time, if the inflammation isn't controlled, the body tries to repair the damage in a way that makes things worse by forming new bone. That can lead to parts of the spine actually fusing together, which limits flexibility and makes movement more difficult. So what's actually driving all that inflammation? It comes down to something called cytokines. Cytokines are small proteins that immune cells use to communicate with each other. They help control inflammation, fight infections, and tell your body when to heal. Think of your immune system like a team. Cytokines are the messages they send to organize the response. But in AS, the messaging system goes haywire. The body keeps sending out alerts even when there's no problem. It's like a group chat that keeps buzzing all day and night, shouting, "Attack! Attack!" when there's nothing to fight. That nonstop signal causes the immune system to attack healthy tissue, especially in the spine. And that's what leads to ongoing inflammation and damage. Researchers have identified a few key players in this messaging chaos, and that's where treatments are aimed. TNF-alpha, this is one of the main cytokines cranking up inflammation. Think of it like the immune system's megaphone, very loud, very aggressive. Another cytokine involved in AS is IL-17, and it's meant to help defend against bacteria. But when it's overactive, it fuels joint and spine inflammation, especially where tendons attach to bones. Then there are JAKs, or Janus kinase. JAKs aren't cytokines themselves. They're enzymes inside your immune cells. When a cytokine knocks on the cell's door, JAKs carry the message inside. You could think of them as the wiring that transmits the signal. So the first line of targeted treatment are biologics. Biologics were the first major breakthrough in treating AS when NSAIDs weren't enough. So what are biologics? Biologics are lab-made proteins that specifically block one part of the immune system, usually TNF-alpha or IL-17. They're made using living cells, which is why they're called biologics. These medications are given by injection or IV infusion. They're not taken as pills. So how do they work? Biologics act like snipers. They target and block one particular cytokine to stop it from sending its harmful signals. So examples of TNF inhibitors are Enbrel, Remicade, Humira, and Cimzia. Examples of IL-17 inhibitors are Cosentyx and Taltz. So these may take several weeks to work, and they require screening before starting. So you'll do a tuberculosis test. and these inhibitors can increase risk of infections or cause injection site reactions. Those are two of the more bigger side effects. You also have something which is called biosimilars, and they are more affordable but just as effective as the brand name Biologics, or the bigger name Biologics. Once a Biologics patent expires, other companies can make biosimilars, nearly identical versions that are just as safe and effective. They're not considered generics because they're made from living cells, but they are closely matched copies. So examples are Amjevita, which is a biosimilar to Humira, and Ecovo is a biosimilar to Enbrel. Biosimilars help lower cost and increase access, which is important for a long-term condition like AS. And then there are the JAK inhibitors. JAK inhibitors are another targeted option, but they work differently than biologics. What makes them different? They're not biologics, they're small molecule drugs made chemically. They're taken as pills, not injections like biologics. They're pill form. Instead of blocking one cytokine, they interrupt the internal signaling inside immune cells. JAKs are like wires inside immune cells that carry cytokine signals. JAK inhibitors cut those wires. They prevent the signal from ever reaching the cell's command center. So approved JAK inhibitors for AS might be Xeljanz or Rinvoq. So things to consider, they're pills, not injections. So they are often easier to take. They require regular blood tests to monitor side effects. They may increase the risk of infections, blood clots, and other serious issues. So they're often used when biologics haven't worked. So for choosing the right treatment, there's no one-size-fits-all answer. Your doctor will look at how active your AS is, whether you have other autoimmune issues like IBD or psoriasis, your comfort with injections versus pills, risk factors like heart disease or clotting history, the cost, what the insurance might cover. So there's a few variables, and it often takes a trial and error to find out what works for you, and that's totally normal. The good news is we have options, real powerful ones. So let's recap. Cytokines are immune messengers that go haywire in AS. Biologics block those messages, one target at a time. Biosimilars offer the same treatment at a lower cost. JAK inhibitors go inside the immune cells and cut off the signal. And with all of these tools, you and your doctor can find a treatment plan that works for your life. And this has been AS InfoShare. Please, if you can, like our page, subscribe, leave comments, and just engage with us. We'd love to hear from you. And please share. More than anything, please share this and get the word out. Spread the message of AS InfoShare. Thanks for tuning in, and we'll see you next time.